Welcome everyone to sqadia.com. This is Mohammad Osama, and today we are talking about environmental pathology. And we are talking about physical injury in the previous part of this lecture, and we're going to extend into that. And we talked about the mechanical injury, and now we are going to talk about the thermal, electrical, and radioactive type of mechanical or physical injuries. So, what is a thermal injury? A thermal injury is because of severe or greatly increased temperature or very low temperature. So, in very high temperature can actually result in burn, and very low temperature can actually result in freezing. So, burn and freezing are both two different types of physical injury, and specifically two different types of thermal injuries in the physical injury. So burns can be of different types. They can be divided into first degree burn, second degree burn, and third degree burn. First degree burn and second degree burn are also known as partial thickness burns, whereas the third degree burn, which is the most severe form of burn, is known as full thickness burn. So let's start off with the first degree burn. So in first degree burn, there is no significant epidermal damage. However, there is hyperemia and redness of the skin at the site of the burn or injury. And the best thing about first degree burn is that there is no significant damage and it heals without any intervention. So here you can see it looks like this. So there is hyperemia, but there is no epidermal damage, and you can see it is just localized to that superficial layer of the skin. In the second part, we have the second degree burn, which is also a partial thickness burn. But in this, you can see that blisters are formed at the site of burn or injury along with hyperemia. And there is also destruction to the epidermis. However, there was no destruction to the epidermis in the first degree burn. And there can be slight damage to the underlying dermis, but there is destruction to the epidermis. And once again, the good thing about this type of burn is that it also heals without any intervention. But there are blisters and there is damage to the epidermis. In the third degree burn, this is known as full thickness burn, and there is damage to epidermis, dermis, and dermal appendages as well. For example, different type of glands and hair follicles, etc., which are present in the skin. And it looks like this, and there is a very extensive injury, and skin and underlying tissue is charred and blackened as well because of the burn, and it cannot heal without any intervention. So intervention is necessary, and usually it requires skin grafting to heal. Now, what are the complications that can occur in conjunction or in association with burn injury? So first of all is during the burn injury, a person can inhale the smoke or toxic fumes, which may lead to pulmonary and systemic damage. The second is hypovolemia, which is the decreased blood volume, and it occurs because of the increased fluid and electrolyte loss as a manifestation of burn. Other than that, there's also a curling ulcer, which is also a complication of the burn, and it can result as an acute gastric ulcer in the stomach associated with severe burns, and infection because the protective layer of the epidermis has been disrupted. So there can be an infection, and this infection is actually the major cause of late fatalities after burn injury has occurred. And the most common organism which is involved in these infections is Pseudomonas aeruginosa. Now, the other type of thermal injury is actually freezing, which is exactly opposite to the burn. So they can either be generalized and result in death because of significantly decreased body temperature, or they can be localized and they can result in a condition which is known as frostbite. And the localized type of freezing injury or frostbite usually affects areas that are exposed, such as hands, tips of the fingers and toes, nose, ear. So these type of structures are usually involved in frostbite. And if there's a severe prolonged frostbite, it would result in intracellular ice crystals, which are formed in the normal tissue, which leads to ice formation inside cells, and which then results in the intracellular ice crystals, as you can see in this picture right here. And it can also result in intravascular thrombosis, in which a blood clot would form in the blood vessels, and which can also lead to local gangrene, and then the body part or the limb has to be amputated. Now, electrical injury. Electrical injury is damage caused by electrical current passing through the body, and there is a wide array of symptoms, and it ranges from skin burns to damage to internal organs and other soft tissues to cardiac arrhythmias and respiratory arrest. And what type of symptoms would be there? It depends on a lot of factors. So, what are the factors that would actually affect the extent of the electrical injury, and what type of symptoms would be there, and what type of structures would be involved, is the Cohen-Hovens factors. So the Cohen-Hovens factors include the type of current, the voltage and amperage, the duration of exposure, the body resistance, and pathway of current. So let's start off with the type of current. So there are two types of current, the direct current or alternating current. So alternating current is more dangerous than the direct current in causing an electrical shock or electrical injury. As shown here, we can see that a low voltage 60 hertz current, which is traveling through the chest for even a fraction of a second, can cause ventricular fibrillation at an amperage as low as 60 to 100 milliamperes if there is an alternating current. On the other hand, for the same type of ventricular fibrillation to occur, the amperage requirement for direct current is around 300 to 500 milliamperes. So you can see that alternating current is more dangerous to direct current. On the other hand, the measures of current strength, it can either be because of the electromotive force or voltage, or it can either be because of the amperage or the current flow. So high voltage for a greater than 500 volt currents tend to cause deep burns and involve internal organs as well. And low voltage currents, for example 110 to 220 volts, which are usually present in our home, and our home appliances actually operate on this voltage, they tend to cause muscle tetany, which is the uncontrolled contraction of the muscles and freezing contact to the current source, as the person cannot move. So for an average person with 70 kg weight, the let-go current is about 75 milliamperes for direct current and 15 milliamperes for alternating current. So once again, emphasizing the fact that alternating current is more dangerous. And secondly, what is let-go current? Let-go current is that amount or that measure of the strength of the current at which muscle tetany occurs, but a person is not frozen in contact to the current source, but he can move away from the source. So that is let-go current. Now, duration of exposure is also very important. The greater or the longer the duration of exposure, the greater and the more extent would be there for the severity of injury. Now, body resistance. It can have two different types of manifestations. For example, if the skin resistance is high, for example, in a dehydrated skin or in older individuals, more electrical energy would be dissipated at the level of the skin, and it would not flow into the deeper structures. So it would result in greater amount of skin burns. However, it would result in lesser amount of internal damage or visceral damage. But if skin resistance is low, then there may not be much extensive skin burns, but there would be a greater internal damage. Now, pathway of the current also signifies and determines that which type of tissue would be damaged. Now, the radiation injury. Radiation injury, for example, can be occur because of ionizing radiation or nuclear radiation or X-rays or stuff like that. So another one type of radiation is the ultraviolet radiation or the ultraviolet light, for which the ozone layer around our Earth actually protects us from this ultraviolet rays of light, and which can be harmful for us. So what happens because of the ultraviolet rays is ultraviolet rays is a very common condition seen in fairer individuals, especially Caucasians, is the sunburn, in which there is erythema, redness of the skin, often with superficial desquamation, and in severe cases blister formation as well. On the other hand, it is associated with pre-malignant cutaneous lesions such as actinic keratosis, as you can see here in this picture, and even malignant cutaneous lesions such as squamous basal cell carcinoma and melanoma that we'll look into the next picture. So there are different layers of the skin and different type of structures in those layers. So in the superficial, the most superficial, or in the epidermis, is the squamous cells, and the basal cells are beneath the squamous cells, and the melanoma is the deepest because it is in the melanocytes, which are actually the pigment cells which give the color to our skin. For example, in Negroes there is extensive melanin, and in fairer individuals there is less melanin because of the activation or the production of the melanin by the melanocytes. So squamous cells most superficial, so squamous cell carcinoma is in the most superficial layer. Basal cell is beneath the squamous cells, so it is a bit deeper, and basal cell carcinoma is of those basal cells, and melanoma is of those melanocytes, which are pigmented cells which give the color to our skin. So these are the three different type of you can say malignant cutaneous lesions that we talked about. Now, another type of radiation injury is the ionizing radiation, which can either be because of X-rays, radioactive waste, and nuclear disasters. So these ionizing radiations damage the cells by forming toxic free radicals, which ionize different type of structures in our cells, especially affecting the DNA, which is the deoxyribonucleic acid, and the intracellular membranes of different organelles in the eukaryotic cell. Now, these type of radiation can be divided into two types. They can either be localized radiation exposure or generalized radiation exposure. So when we're talking about the localized radiation exposure, only one part is exposed, or a specific part is exposed. So in localized radiation exposure, skin changes occur usually with the inflammation of the skin, which is the dermatitis, ulceration of the skin, and skin malignancies, as we discussed in the previous slide as well. It can also result in pulmonary changes, and acute changes involve similar to adult respiratory distress syndrome in pulmonary changes, whereas chronic changes in the pulmonary system include septal fibrosis, bronchial metaplasia, and hyaline thickening of the blood vessels in the pulmonary circulation. Now, gastrointestinal tract inflammation and ulceration can also occur in response to or as a manifestation of the ionizing radiation, and hematopoietic alterations such as bone marrow depression resulting in decreased production of blood cells and leukemia can also occur. Other than that, neoplasia such as myeloid and lymphoid leukemia. In myeloid leukemia can occur, but lymphoid leukemia does not occur in response to ionizing radiation, because myeloid leukemia is associated with the production of the WBCs in the bone marrow, and that's where the problem is usually occurring. And neoplasia in the skin can also occur, as malignant tumors in the skin can also occur, as we talked about, such as squamous cell carcinoma, and the neoplasia in thyroid can also occur, as well as in the pulmonary system or the lung neoplasia, and breast cancer or the neoplasia in the breast that can also occur. On the other hand, in generalized radiation, whole body radiation such as occurs in the nuclear disasters, and severe central nervous system injury caused by capillary damage, and gastrointestinal tract mucosal denudation, and acute bone marrow failure resulting in decreased production of the different type of blood cells. Now, different type of cells have a different type of sensitivity for radiation exposure, and if the cells which have the highest level of sensitivity are the radiosensitive, and with the least amount of sensitivity which do not respond to that are the radioresistant, and between them are the intermediate radiosensitivity type of tissues. So radiosensitive because they are highly metabolic and dividing. They divide at all stages of life, so they regularly divide and they undergo mitosis. So they can be affected by the radiation exposure and can result in different type of tumors and malignancies. So they involve lymphoid cells, hematopoietic germ cells or hematopoietic cells in the blood, bone marrow, germ cells, gastrointestinal mucosa, and rapidly dividing tumor cells. And the other hand, radio-resistant cells, because they do not divide or they have stopped dividing shortly after fetal development and birth. So they are very much resistant to radioactive injury. And these include cells of bone, cartilage, muscle, central nervous system, kidney, liver, and most endocrine glands. The intermediate type of sensitive tissues include fibroblastic cells, cells of endothelium, which is the lining of the blood vessel walls, elastic tissue, salivary glands, and eye. So that was all about the second part of the physical injury, in which we talked about thermal injuries, electrical injuries, and radioactive injuries. I hope you learned something new out of it. So stay tuned for the other parts of the lecture and keep on watching sqadia.com. Thank you very much.